This video will be learning about another, I would not say it's a mistake, but another thing many doctors don't do. And when we were preparing in a study group, we did this a lot, and this helped a lot for us. When I say us, it's me and my friends. We all passed with flying colors. Unfortunately, my friends were had to take the exam second time, but before I met them, they've already failed. And when we formed as a study group, I passed my exam in the first time, and they were taking the exam second time, but they passed straight away. They had no problems at all. So I have discovered this strategy called quizzing strategy. Okay, so this is a strategy where we randomly ask questions. Every day before we start this random quizzing strategy. Okay, so what we do is we will ask some random questions out of the blue. You don't prepare for this. You just ask random questions. We had a study group of 3 people, so I used to ask them. So differential diagnosis of um, you know left-sided chest pain, or differential diagnosis of right arm pain, or investigations in a rape patient. Okay, so screening for Down syndrome. Random questions. We will not have a plan and come prepared saying, okay, so today I'm going to ask about, or tomorrow we are going to ask about chest pain, or we are going to ask about investigations of rape. Just you get some random questions and you ask the group, and once you are actually discussing these things, you will probably miss few things. So what we used to do is, first 5 minutes we usually go back, we take the book, read those 3 random questions. So every day we used to have random questions like this. Some of them used to be immediate treatment if someone collapsed in front of you. What is the CPR, cardiopulmonary resuscitation? Can you show it on him? Okay, on a pillow, or the patient collapsed, show this. So we used to do something like this. So that used to sharpen our brains, and we used to discuss a lot of strategies as well. So I would advise you guys do the quizzes strategy, because this will help a lot. This will sharpen your thinking skills. This is like brain training, and this will actually it's like a recall or refreshing your subject, so that you're actually sharp and you're thinking sharp. And we used to set time as well. We will say, okay, for differential diagnosis for a patient who lost consciousness, you have 30 seconds to tell this. Okay, so we used to stress our brain. We used to do it under high pressure situation. And just because of this, I passed all 16 stations, and my friends passed the exam second time as well. They're very clever students, but unfortunately, when they took the exam first time, they failed. But when we prepared, we all 3 passed, and that is because of the strategies we use. So make sure you use these strategies when you're preparing, and I can tell you, you will surely pass.